Hello, and welcome to the NYRx Step Therapy webinar hosted by NYRx Education and Outreach Team. We will begin by defining step therapy, which is indicated with an ST red superscript in the preferred drug list known as PDL. Step therapy criteria is designed to ensure clinically appropriate and cost-effective use of a drug or drug class and is based on FDA labeling and current clinical practice guidelines. We will take a look at a couple of examples to explain the criteria requirements related to step therapy. In this example, the parathyroid hormone analog drug class has a step therapy parameter that will apply. Step therapy criteria requirement for this drug class requires a trial with a preferred oral bisphosphonate. In this example, we will look at the non-preferred drug, carasprotol, which is subject to step therapy requirements as indicated by the ST red superscript. We will reference the step therapy criteria located in the prioritization/coverage parameters column under the clinical criteria, which states a trial with 1 analgesic and 2 skeletal muscle relaxants prior to the use of carasprotol containing products. Next, we'll provide some information regarding the NYRxEO team and how to contact us. The purpose and mission of the NYRxEO team is to serve as a liaison between all stakeholders and NYRx to support care coordination. This team assists New York State Department of Health and its stakeholders by ensuring members receive their medication in a timely manner, facilitate intervention and access for medically complex cases, provide detailed information about NYRx drug coverage, prior approval requirements, and NYRx enrolled pharmacies. The E&O team is comprised of clinical liaisons who are trained to support complex pharmacy cases specifically for members who have HIV/AIDS, hemophilia, are in foster care, have serious mental illness, substance use disorder, or hepatitis C. The E&O team serves as a resource for NYRx program-related questions and supports New York State by offering educational opportunities such as this webinar. The E&O team hosts virtual drop-in office hours for various audiences throughout the week. These sessions are available to all stakeholders. We welcome you to hop in, ask a question, and get support when it's convenient. Office hours are also available by appointment. If a particular provider or group of stakeholders need support, this is especially convenient if it requires PHI discussion. For office hour inquiries, please send an email to NYRxEO@primetherapeutics.com. For more information about resources and tools that E&O offers, please visit our website. This slide contains E&O call center contact information in addition to the E&O website, mailbox, and subscription service. The E&O call center can be reached by calling 1-833-967-7310 Monday to Friday, excluding holidays, from 8 a.m. to 5 p.m. Eastern Standard Time, or by emailing at NYRxEO@primetherapeutics.com. Please note, if calling to discuss protected health information known as PHI in the E&O call center, callers must have a MPI or an individual verification number known as IVN, which requires a provisioning process to keep member information protected. To find out more information about this process or to request an IVN, send an email to the E&O mailbox. NYRx Educational and Outreach Notification Service is a new free service that keeps stakeholders up to date on the latest news for NYRx, the Medicaid Pharmacy Program. To register, use the QR code in the third box or click Subscribe today. This concludes the NYRx Step Therapy webinar. NYRx Education and Outreach would like to thank you for joining us today, and we hope this information was helpful.